All right, all right. Good afternoon, everybody. We'll get cooking in just a minute. Welcome, everyone. Oh, I want to go back here first and say, hey, we're going to start this in just a minute, but let us know where you're coming in from. Where are you guys coming in from? Jason?
From Reno, Nevada.
Reno, Nevada. Is that where you are as well, Jeff?
It sure is.
Awesome. Been through there, never been really to there. So, how about you, Dr. Jim?
Oh, Yanceyville, North Carolina, man, the land of tobacco, corn, and farms, cattle, and pig.
Ah, farms, cattle, and pigs. Love it. And we got Stephen from Quincy, Massachusetts. Awesome. Welcome, welcome. Let us know where you're coming in from. Always like to know. And especially if you're coming in from an exotic place. Like, we always like the more exotic places. Hey, people could be on vacation or be working from various locations now, right, Jeff?
Yep.
That's right.
Love it. All right, let us know where you're coming in from. Always like to know. We'll get in with this into reducing the pesticide footprint. That's a new term for me. What does that mean, Jeff Van Diepen?
Well, it simply means just like in a carbon footprint that we want to measure what amount of pesticides being applied and hopefully with the goal of reducing the size of a pesticide footprint on federal facilities and other agencies across the nation.
Love it. Speaking of exotic places, Leo's coming in from London. So, see, you never know, do you? You never know. Chip from Jacksonville. I love Jacksonville. One of my favorite cities. They have a great chamber of commerce there in Jacksonville, I will say, Chip. So, all right, welcome. Let us know where you're coming to. Gainesville, Florida. Got a fellow Floridian there. Michael, you and Chip can get together somewhere in the middle between the Jacksonville and Gainesville. All right. Let us know where you're coming in from. I'm actually coming in from Woodstock, Maryland, which is outside Columbia, Maryland, which is kind of sort of between D.C. and Baltimore. There's another one. Neil's coming in from Honolulu.
Wow.
That is
Nice.
awesome.
That's great.
And Karen's coming in from Guatemala. See that? You never know where people are coming from, guys. Love it. Love it. All right, we're going to go ahead and get started. I want to welcome everybody to Reducing the Pesticide Footprint, Advancing the Public Health and Cost Efficiency in Government Facilities. That's one of the longest titles we ever had here on GovBrief, Jason. Just saying.
We always set the standard.
That's right. Yeah, there's always have somebody. We want to welcome a lot of folks. We love these interagency briefings. We love doing it. Love being able to throw information out there and make sure we get the communication going back and forth. Appreciate everybody. I think I just talked to somebody from Department of Energy, as a matter of fact. I just want to make sure the email was right, so I picked up the phone. So anyway, welcome aboard. We appreciate you guys joining us today. We know we have a lot of things that you're up against, especially as we get into fiscal year end. Today we got Jason Verdon. He is from Reno, and Jeffrey Van Diepen is also from Reno, and Jim McCormick is from where? In North Carolina?
North Carolina is good enough.
North Carolina. And I'm coming in. I'm Dave Lowe. I'm the GovBrief host for you today. Quick disclaimer, this session does include vendor communication, so that's why GSA gave this to us for you. It's not affiliated or endorsed by GSA or any other agency, and your participation is voluntary, and it's not an indication or endorsement to purchase from any vendor that happens to be here, the vendor being Ecological Engineers. We are recording this, and you will get a copy of that as well. We always love to have interaction with you guys, so feel free to chat, feel free to react. You can throw stuff at us if you don't like what we have to say. Raise your hand, put in the Q&A, whatever it is. We'll even accept people from Pittsburgh, Andrew, just saying. Being from Baltimore, you know how that goes, don't you? All right, we do love the feedback, and in fact, the first thing I'm going to ask is feedback that if you could do me a favor and let me know if this particular link that you click on takes you to something that looks like this. We have session docs, which includes the executive order, the white papers, pesticide exposure, disease risk, and including the presentation itself. Click on that for me and let me know that actually goes to this, and you can actually see it. Everybody good? Michael's got it. Thumbs up if you got it. Keith's got it. All right, then what we want to do, I want to show you how this works because it's really easy. If you can get to this, just click this download. It'll suck them all down and put them in a zip file, and it'll be in your download folder. Cool? Everybody got it? That's all we want to do today. Good deal. Love it. Love that you guys are doing that. All right, fantastic. And now I'm going to start asking questions like, why in the world did you decide to join us today? Of all reasons, trying to understand this pesticide footprint thing, right, Jeff? That's what we're about.
Yeah.
Right? Maybe you're responsible for pest control. Maybe you have an issue with products that are being used today for pest control. Maybe you're looking for effective alternatives, or maybe your boss made you come. And we know there's going to be at least one Weisenheimer, Jason, that picks that last one. We know that for sure.
I think I've done it a few times.
Somebody's going to do it. And if you have anything you'd like us to address, please let us know. We did ask this on the way in when you guys were doing your registration. Best briefing ever. Nicole says, have a better understanding of pesticide regulations. We'll touch on that, won't we?
Yep.
Just a little bit. Adria, interested in food supply impact. We do have that, Jason, right? We do have an impact on the food supply. Jason, Karen from Department of State, you share your knowledge of best practices to ensure POSHOs and cores are invited. I'm not sure if we got all of them, Karen, but we invited as many people as we can. So hopefully they get it. If not, record it. It's being recorded. You can send them the link. Michael from USGS, it was concise and to the point. Got that? Got that, guys? Well, we'll see how we do. We know we're going to do to get you out of here about 5 minutes before the hour. Do our best for that. Brian from the VA covered contracting officer roles and insurance compliance with the EOs. Love that one. I'm not sure how much we're going to get into the contracting, although we can talk about that offline if we need to, if we don't do enough. Loretta from the VA, explain how chemicals affect pets. Not just people, right, Dr. Jim?
That's right. People too.
There you go. People too. Andrew at the Corps, Army Corps. Harmful chemicals are detailed and alternatives are recommended. What do you think, Jeff? We're spot on with that.
We are.
All right. Stephanie from the VA, have specific examples how to use this in contracting. Love all that. Really appreciate those. And please address, what program managers and contracting officers' roles and responsibilities? Can certainly give them some information they can put in the scope. Don't you think, Jeff?
Absolutely.
Yeah, love it. Why we should not spray chemicals on base. Woo, that's a hot one. The need for federal agencies to adopt prevention, the first line of defense. Love that. How to use any pesticide, decided on what to be used on federal properties. Like that one too. I think that's what we're talking about. How to use different pesticides, right? Right, Dr. Jim?
That's right. Different ways to control pests on our bases, our plants, and our parks.
Love it. Are there any pesticide use and environmental assessments done before applications? I don't know that even happens. Does that happen, Jeff?
Not enough, that's for sure.
But it's a good thing to do, don't you think?
Absolutely.
We'll talk about that. Alternatives to any pesticides. Love that. Alternatives, innovative solutions. Again, to reduce chemical reliance. Love that. How to identify harmful chemicals and alternatives. Love this. Everybody's asking the right questions, Jeff. How to use data and technology used improving efficiency and reducing manpower. Because you're going to talk about a little bit about that too, right, Jason?
Yep.
Awesome. And pesticide labels and SDSs. What does that mean?
Safety data sheets.
Safety data sheets. I think we got a couple of those in there, don't we?
Yep.
And the handouts? Love it. All right. So, got a little bit of the introductions. We'll do a little bit more to tell you a little bit about ecological engineers. We're going to understand what your pesticide footprint looks like and how you can help meet MAHA as well as the executive order 1412. And then talking about pesticides use, how you're doing it today, right, Jeff? That's what we're going to be talking about. And cost exposure. We're going to pull down some of the costs, hopefully, to be able to reduce some of the costs and make Doge happy. We all got to make Doge happy, right? And some of the next steps for you guys to be able to do this. Love it, love it. Jeff, give us an idea. You started Van Diepen Enterprises. Tell us a little bit about your history and what made you get into this world.
Well, appreciate that. And the intro on the whole presentation. My name's Jeff Van Diepen, and I live here in Reno, Nevada. and I live here with my significant other and better half, Shelley. I have 2 adult children as well as 4 grandchildren, all here in Reno. It's hard to believe, but I've actually been in the pest management industry for a half a century of experience. I was the founder of a national pest management company called Pestmaster Services, and I also founded a franchise system under the same name, Pestmaster. And when I sold the company in 2020, there were actually 40 franchises in 17 states, and the company is ranked number 45 out of 21,000 pest management businesses in the country.
Nice.
We're also the number 1 small business service provider of the federal government at that time. I'm proud to say that I'm one of these people that has truly lived the American dream, and it's just been a tremendous experience. But there's a number of things that I learned along the way that I'd like to share with you guys. One of the first things that I really embrace is the fact that people don't care what you know until they know that you care. And we care about health and we care about environment. And we're doing this effort with ecological engineers and demonstration of that. We're also very committed to education and learning how critically important it is having education to grow our business as well as to develop a value for our customers. I was in my mid-50s when I went back to school, earned my MBA at the Pepperdine University in Malibu, California. And that's actually where I met Dr. Jim McCormick, who will be speaking a little bit later. After the sale of the business, I took a step backwards and just kind of took life a little bit easier. I did a lot of travel. I've been on every continent in the world now. But I also volunteered to be a command pilot because I am a private pilot. So I became a command pilot for Angel Flights, which is a nonprofit organization that's involved with a non-emergency medical transport.
Very
also,
cool.
Fire Patrol. Did you want to say something there?
No, I was just saying that was very cool. I didn't have any. I've never met anybody that done that before.
Yeah.
It's very cool.
I still do that. I'm also a second lieutenant in the Civil Air Patrol here in the Reno Squadron here in Reno.
Nice.
The sabbatical from the business, which has now been about 4 or 5 years, has kind of given me a lot of opportunity to reflect on what's going on in the industry and see what's evolving. And I can say that. That in my heart and in my mind, I would just like to see more improvements in the pesticide industry as well as the pest management business. People say, well, why are at this point in your life are you going back into this business? Well, it's because I love this business. I love the industry, but I also see lots of areas where it really needs some improvement. And so that's one of the reasons that we're doing this is we see an industry that needs change. And in the next hour, I hope you'll be able to see some of those things yourself and be able to identify along with us areas that we can improve pest management and become essentially change agents for what's going on in the future. Okay. So let's move to those slides.
Yeah, you got it. All right, let's find out. Are you using, this is more of on the personal side, right, Jeff?
Yes.
Right, so on a personal side, are you using any of these? We'll get into the professional side in a minute, but this kind of ties into the fact that we're all doing these things ourselves too at our houses, right? I mean, I know I am. I'm killing weeds. I'm killing bugs, doing everything like that. So we'll get a little dose of that from the folks to see what they're using, if they're using any of those, and then tell us a little bit about what you see how this impacts for 1412, the initiatives that are laid out from Executive Order 1412. Talking about toxic material, tell us what you see here and how we're tying this in with the EO.
There's certainly been a lot of attention on food, and this administration under Secretary Kennedy has definitely got his gun sights on food. But in addition to that, he's also got his gun sights on pesticides, environmental factors, the toxic materials, even food production itself. There's a lot of pesticides that go into food production. So it's all kind of related and will be tied together, and with the goal that I think all share in common, and that's that the United States be the healthiest country in the world. That's our goal too.
Yep.
I do have a question. So Leo is saying he don't know if it's just you, but he's getting a little feedback from somewhere, a little echo. Anybody else getting that? I'm not getting it on my side. Jason, you hearing anything?
No.
Not
No.
saying it's not happening, Leo. we want to make sure we get it fixed. Maybe pop out and pop back in, see if it solves the problem. Love that. And Karen said, I appreciate if you could recommend an eco-friendly product for termites. All right.
We'll get to that.
We'll
Certainly.
get there. Awesome. So to your point, HHS, Secretary Kennedy, putting out with MAHA actions, they're already making changes for like food toxicity, and they targeted the dyes at first, but there's a lot more than just dyes, right, Jeff?
Yeah, there certainly is, and we could spend all hours discussing some of these connections between not just dyes but pesticides that are now easily identified in the production of food. So, but we'll have to save some of that for another discussion.
And we're seeing that they're doing things, and industry's responding, voluntarily removing some of the food dyes, not all of them, but at least moving in the right direction. And that's one of the things I think that people can walk away from today, is that there are things that they could do today, isn't there?
Yes, there is.
Love that. So you don't need an EO to do it. And you don't need any initiatives. You can just, hey, it'll work. So go ahead. Let's talk about the current approach.
So one of the things I've identified looking in the rearview mirror, which is 50 years, I can say that there are so many of the service protocols that go on today that are essentially unchanged from 50 years ago. And we've seen these different pesticides come and go, the chloridane, then, that was banned, and then we were moving toward diazinon, and that got banned, and Dursban, and that got banned. One of our latest and greatest products that we're using is a material called fipronil, commonly known as Termidor, and that product is now coming under more and more scrutiny. So it's always interesting to watch this evolution of these materials that are coming out. But the bigger concern I have is that there's a notion out there in the industry that we get paid by the gallon, and that's really a very bad way to consider the pest control industry. We shouldn't be paid by the gallon. And the routine application of pesticides is something that we really need to focus some attention on and see if it really makes a good sense. I like to use the example of a doctor. And so if you walked into a doctor's office, for example, and the first thing the doctor did before he asked you how you're feeling, took your temperature, evaluated your health, first thing he did was, start pumping you full of antibiotics, what would that doctor be guilty of? Well, he'd be guilty of medical malpractice. And I'm going to submit to you that we as an industry are guilty of pesticide malpractice when we show up at any kind of a building, commercial, government, private, and we just automatically, routinely start applying pesticides when there's no presence of any pest infestation or pest concern. There's a lot of lip service that's gone into this notion of IPM, integrated pest management. But unfortunately, I can tell you, it is lip service in many cases. And we observe, pest control companies, doing their business, and they're doing that same thing that we were doing 50 years ago. And that's just showing up and just starting to apply pesticides around people's homes and in businesses, as well as government facilities.
And we see that sometimes in the scope of work in RFPs too, right? Where they're saying, hey, we need you to do X amount of this to prove that you're actually doing something.
Yeah, and I think the change needs to be that we're not evaluated based on the amount of pesticide that we apply. We're based on what we consider the absence of pests. So
imagine that.
That's what we sell in our business. Is we sell the absence of pests, not the gallons. We're not a gas station. We're not a filling station where they pay based on how many gallons we apply. So that's definitely a paradigm shift that we see needs to happen.
So tell us about some of the effects. Now, these are in the handouts too, so everybody can get that. And Karen has an echo too. Hopefully, if you pop out and pop back in, Karen, that'll help. We're going to find out what that means, because we don't usually see that. Hopefully that works. So
time for us to cover all these alpha effects related to pesticides, but these are structural pesticides that are commonly used, and even though a number of those are listed as non-carcinogenic, we just need to have some focus on and some clarity on the other risk factors that are associated with these pesticides, many of which are used on the inside of homes and inside of businesses. So. At your leisure, you can review those, and a deeper depth conversation can certainly be had on each one of these individually.
And let me just share this with everybody, because we have some folks using Ortho, we have some folks using Roundup, we have folks using other off the shelf. Let me read a couple of those things and see what they have to say. Stephanie leaves that to the lawn servicer, right? That's another part. So chances are some of that stuff's getting dumped on your lawn.
It is.
Steven saying, hey, mostly organic in my job, very little pesticide use. Love that, Steven, right? National Park Services, flying insect killer. And Andrew and Jessica's not using any of them. Love that. So take us through, I'm sorry, go ahead.
No, like I said, that's nice, and I'm glad to hear that's the case. It's the anomaly, not the norm. I can tell you when we find folks that are doing things the right way like that.
Yep. So take us through a case study here using bait stations. Most people have seen these. I've seen them. Everybody know what bait stations are? Thumbs up. Good.
Yep. There's hundreds of thousands of these that are being utilized throughout the country, and these bait stations routinely have anticoagulant rodenticides inside of them. The problem with anticoagulant rodenticides is they bioaccumulate in the tissue and in the organs of the rodents that consume them. And once those rodents head out away from the bait station, they're gradually going to die, but they don't die immediately. It's a chronic rodenticide, so it kills over a period of time. That having been said, once they're sick, they're in a weakened state on their defense. And so they're easy prey for birds of prey. They're easy prey for other non-targets, such as coyotes and bobcats and possums and raccoons. And unfortunately, those active ingredients start working their way up into the food chain. Let's go to the next slide. The unintended consequences are, birds of prey like this beautiful owl grab this rat and takes it back to the nest, feeds its chicks. And if you push the button again, you can see that the chicks that the owl feeds the rat to are going to die. That's an environmental issue. That's a concern that we should all share when we're selecting any of these products. Moving to this slide, I think this is a critically important slide, that all things are connected. Is really important to understand that little green bait station and the rodents go in there, and then as it moves on up into the food chain, these are real consequences of utilizing these rodenticides. And some of the states are becoming more and more aware of that concern and are bringing in more regulation with respect to the use of these. But I can tell you that these anticoagulant rodenticides are widely used, continue to be widely used across the country, and there's some very negative environmental consequences that go along with it. And here's one of them. So this mountain lion actually succumbed to the poisons and the pesticide that's in these anticoagulant rodenticides. And it's certainly not because that mountain lion was in a bait station. So it's worked its way all the way up the food chain from the rodent all the way up all the way to the mountain lion, and that's just a sad situation and something that needs to be avoided going forward. So that begs the question. Okay, well, we know we've got rats, we know we've got mice, we know we've got other rodent problems, and those are disease carriers. So what are we going to do about it? Well, one of the things that we absolutely endorse is the use of monitoring blocks in these bait stations. So rather than just automatically employ a toxic bait in these stations, and monitoring blocks, which are non-toxic, but will establish whether we've got any concerns with rodents. Once we do have concerns with rodents, then we can employ some of the other techniques to get them under control. Other thing we really like is motion detection in these bait stations. So the motion detectors can be installed in these bait stations, and it sends a signal out to the pest control person that there's activity going on in that station and it probably needs to be addressed. And then we can deploy other techniques accordingly. We really like fertility control. There's a company called Synestec that has developed a product called Contrapest that we endorse. We like it because rather than using a harsh pesticide that's going to kill and potentially have secondary poisoning to non-targets, this fertility control just keeps those rats and mice from having offspring. And since mice and rats typically live about 1 year in the wild, if you stop that fertility and you stop that reproduction, just out of attrition, you're going to be controlling some of those rodent populations. We also like repellents that are not used enough, pushing rodent populations out of certain buildings using repellents rather than trying to put baits out and then the rodents consume the baits, and now we've got an odor problem. We've got decaying carcasses in a sub area or in an attic space. That's bad business too. So using repellents to drive them out of there is another good effort that we do. This perk machine that's pictured, and you can push the button one more time there for the next slide, is very effective on burrowing rodents. And it simply uses pressurized carbon monoxide that's injected into the burrow system. And it's a very humane way for us to control these burrowing rodents. The rodents typically die in a couple of minutes. So it's not a chronic killer that takes long periods of time for the animal to have to suffer. And while we're talking about suffering, one of the things that we're very against is glue boards. Glue boards are bad news. They're a terrible way for these rodents to die. And we know we have to control these rodents, but we don't want them to have to suffer any more than they need to. So using an effective control measure like the perk machine is one of the things that we really like.
And if anybody's, I live out in the country, and if you have any of these animals that are boring things up, they can really make a mess.
Oh yeah,
really difficult to get. I love this idea of the perk machine.
Yep,
personally,
we love it too.
Awesome.
Switching to landscape products, I got to say, the landscape products are especially concerning because, as you can see from this slide, and this will be in your handouts, so you can examine it a little bit closer. But there's a number of these that are carcinogenic, and we do have significant concerns about these carcinogenic products that are out there, and it's known. It's actually listed on the SDS that these are linked to cancer. In addition to other, obvious health concerns. So, paying attention to that is important. I had actually another lieutenant in my Army Corps of Engineers squadron that asked me to come out and look at what was going on at his house because he has a pest control program. And one of the products, I said, "Do you have an invoice for the services?" He said, "Yeah." So I looked up the product that he was using, and unbeknownst to him, and probably unbeknownst to the applicator, is they're applying a product that's directly linked to cancer. And that there's not enough attention given to those sorts of things. And I'm going to not steal any of Dr. Jim's comments, but that's coming. Next slide.
Love it.
So the other thing, and this is kind of a point that I think really bears paying attention to, and that's that on these pesticide labels, you'll see on it that there's inert ingredients or other ingredients. I want to shine a light on the fact that this really needs to be paid attention to. I like to use the example. It's kind of like having nitro in one hand and glycerin in the other. You keep them apart and there's not any problem. You put them together, it goes boom. And what we've got with some of these products is when you add the inerts into the mix, into the active ingredient, you've got the potential for that to really accelerate the toxicity, accelerate the dermal exposure. And if it gets in the eyes, it's going to move much quicker than if it was just the active ingredient itself. So don't be under the false impression or illusion that just because it says inert, which sounds like kind of a harmless thing, inert does not mean that it's not hazardous and not dangerous. So these inerts actually enhance the toxicity of that active ingredient, and we need to be aware of that as we're discussing pesticides and we're discussing products that we might use. And I think the next slide.
Next slide is talking about the pesticide footprint. I do have a question from Andrew saying, for rodenticide specifically, what are the general cost differences between the bait station and other methods?
Ooh, that's a tough one to evaluate because it's going to go into the level of infestation, the size of the buildings that we're going to be surveying. Happy to take that as a question that you can email me directly about, and we can take that discussion a little bit further. Sorry, I can't give you a more direct answer to that.
Yeah, we can certainly take a look at that, right? You can take it offline, right? Yeah, absolutely. Love to help with that.
Well, let's go a little deeper into the pesticide footprint. This is a thing that Jeff actually put together as far as the actual footprint itself. But it shows you that all the herbicides, insecticides, fungicides, rodenticides, fumigants, they touch everything: healthcare, structural, agriculture, landscape, mosquito abatement, protein industry, about the foods, utilities, and right-of-ways in the forest. I mean, all the pesticides we use touch every part of our life, no matter where we go. And as you go to the next slide, Dave, and I wanted to point out that the actual pesticide footprint, and this is just taking some of the federal government facilities to give you an idea of the scope of how big the government's footprint is itself, just in a landmass. You got over 200 medical centers and hospitals, 1,193 community-based outreaches. DLA maintains dozens of facilities. The DOE has 28 scientific users, staffing over 30,000 users. Then if you just look at the DOD facilities, the Navy, Army, and Air Force, they have over 4,000 sites, over 439,000 facilities covering 27.6 billion acres of land. So when you think about what kind of footprint does the federal government really have when it comes tying back to the use of chemicals on those bases and those hospitals and other facilities?
That's an incredible number. 27.6 billion acres.
Yep.
That is wild. All right. So let's ask folks this. Have you ever considered alternative non-toxic products? We know some people are, because they told us they're using non-toxic pieces. Maybe you're doing it now. Maybe you've considered it, but you haven't really implemented that yet. Maybe you didn't know that there's alternatives to that. Or maybe you like toxic things. What do you think about that, Dr. Jim?
I don't. I was telling Jeff and Jason the other day that I moved into my house in rural North Carolina 3 years ago. We had a pest inspection, no pests, nothing to worry about. We decided to just hold off on any further pest application around the house. 3 years later, we still don't have an intrusion by ants, caterpillars, or any other crawling insects and pests. And that really makes me wonder, what in the name of God did they put down around my house that has kept everything out for 3 years running?
Wow.
No refreshing. Mm-hmm. So I'm sorry, Jason, keep going.
No, that's okay.
Tell us what, so when you look at this as best practices for agencies, what they want to do, number one, they want to say, hey, where are we at now, right?
Yeah.
What's happening?
By a three-step process. It always starts with an on-site survey. We reviewed an identification of all the pesticides in use and the cost associated with the use. And of course,
that goes right back to Andrew, right? What he was saying. What's the cost for rodenticide? And then you can start talking about other pieces.
Mm-hmm.
And then we always do an analysis of the materials versus links to health concerns, because that's primarily what we're really focused on, not only reducing the use of pesticides, but also the long-term health effects that some of those pesticides cause. And then we always look at the applicator's qualifications and experience. I mean, are they actually qualified to be putting this stuff down, or are they putting themselves and the government at risk by not applying things accurately and properly? And then always the SDS and label review, again, looking at it, how those products are supposed to be handled, the proper use of PPE equipment, and the chemicals and the warning labels that are involved in that.
Jason, if I could add to that on that last slide, if you go back to it,
You
Dave.
bet.
The SDS and label review, it's been a burdensome issue, and there is tremendously good software out there for handheld units called Label SDS. And that Label SDS is a very reasonable subscription, and it gives applicators just the opportunity to have all this information right at your fingertips. So if you're not familiar with it, you may want to take a look at Label SDS and see if that might be a good thing to add. Very reasonable subscription, and really fits the bill on avoiding some of these concerns and identifying concerns associated with any of the pesticide you might choose.
Yeah, that's some good advice right there.
Well, make sure you take a look. Go back real quick.
All right. Oh yeah, take a look at this, guys.
Take a look. So that's what is proper PPE right there. Okay.
Yep.
So let's go to the next slide.
This is a government employee.
Does anyone notice a difference? Okay.
This is
But
my neighbor.
unfortunately, this is commonplace. But you see, no gloves, no long sleeve shirt or eye protection, no respirator. And this is a federal employee putting things down on federal property. And I mean, I guess he didn't have labels SDS, to read the right things there. But
well, the crazy thing too, Jason, is we've heard for years that Roundup is like super healthy for humans.
Mm-hmm.
Right?
The reps back in the day used to drink it in front of you. I mean,
What?
it was insane.
I personally observed that myself.
My gosh.
The manufacturers of Roundup initially would claim it was so safe that they would drink it, they would bathe in it, and it was all to convince us operators 40 years ago that this was a safe product. Well, fast forward 40 years, we're identifying there's lots of concerns associated with that.
All right. So rule number one: at least put on gloves.
Don't drink it. Don't drink it.
Right. They've got a lot of reaction on that one. Holy cow! Yeah, we're not drinking nothing here. We're not.
There's no Kool-Aid here.
And no Kool-Aid here. All right. So then the next part. So once you do that, you start to identify it. Let's talk about what happens after that.
Well, after that, once we've identified the true pesticide footprint, we do a formal report to the stakeholders, and we provide alternatives and service protocols. We recommend reductions of pesticide quantities and the alternatives. And then we train the staff to use our EE Labels SDS software. The proposal for staff training using all the alternatives, the repellents that Jeff mentioned, fertility control, the advanced IPM methods. And then we offer an ongoing audit and training, because we want to make sure we don't just train them once and let them go. We want to keep first year doing it quarterly, then going semi-annual. And hopefully by the third year, they're well trained and versed in the proper use of the alternative chemicals, the right way to do their PPE, and they're making a difference in a healthy way.
And if I could add to that too, Jason, we're not naive enough to think that we're immediately going to change the world with respect to pesticide. It's no different than the goal of reducing the carbon footprint. Our goal is to reduce pesticide footprint, but we know that's not going to happen overnight, and we just want to be able to communicate and educate people on the other alternatives. One thing that I neglected to mention earlier, Natureside is another product. It's a 25B product, non-toxic material that's available. One of the mainstays we have in our structural pest control business, completely non-toxic. So there are definitely recommendations we'll be making on different products that complement this goal of reducing the pesticide footprint.
And real quick, we got 56% that are using non-toxic products now. Love that. And that's 44% didn't know there were alternatives. Hey. Glad you're here. Glad we're talking about it. So once you get through this 3-step, the third part of that is it goes to the team that's actually doing the work. Is that right?
Yeah, but basically this is an option at this point. If they don't have the staff or the staff can't be trained, we do have the ability to replace the current, but whether it be with the other federal employees that we train or to contract with private pest control companies, which the government does a lot of. As we know, as Pest Master, when Jeff and I were there, we were the number one small business provider to the federal government. And, we were a privately held pest control company. So this is just an optional thing that the government already does use by using outside contractors.
So you do the survey, make your recommendations, and then get that to the team, whoever the team is that's going to be doing the implementation.
Yes.
Cool. And we anticipate pushback from that. We anticipate that it's not going to be completely 100% accepted. There's a lot of pest control companies that aren't going to endorse these service protocols. And unfortunately, we've seen some of that in government-run pest management programs. And we just want to make sure that those options are out there and in front of them.
Cool. So common questions, and what's some of the best practice recommendations you got?
Jeff, why don't you take this one?
Well, one of the things that we've become aware of and that we're very committed to is reducing the amount of pesticides applied, especially around schools, especially around playgrounds, ball fields, those sorts of things. Roundup, I happened to cross paths with one of the applicators here in one of our local cities, and he was spraying a road shoulder, and I pulled up in front of him and I said, what are you guys spraying? And his response was, it's just glyphosate. Well, the area that he was applying would have been a perfect application for what's called the foam stream. This foam stream is a unit that delivers 200-degree hot foam, and it's very effective on killing weeds. And we're utilizing that. We're happy to demo some of the results of that or show you what this unit can do. That's one of the things that we're committed to. And again, it's a non-pesticide approach. So we're going to reduce the size of the pesticide footprint by employing this kind of methodology as opposed to us just reaching for the backpack sprayer and mixing up 1% Roundup and starting to spray cracks. We can accomplish the same thing by utilizing the foam stream. That perk we talked about earlier is another thing, but again, I'm going to emphasize to you that the 25B products that are out there are essential in us crafting a good plan for reducing the pesticide footprint.
And Chip's asking, is foam stream price comparable with glyphosate?
Well, the material that's in, the foam stream is just an application piece of equipment. And the foam that goes into, that is delivered would be competitive. It's certainly not going to get acreage sprayed like a tractor would using traditional pre-emergence and sort of thing. It's a slower process, but we think that it's a great fit in many of the areas, and particularly when we're talking about schools, we are very keen on really delivering a non-pesticide approach to school systems across the country. And again, I don't want to steal some of Jim's comments on some of the health related stuff. So.
And speaking of Jim,
take it away, Jim.
All right. Well, thanks everybody for joining the session today. And Jeff, Jason, Dave, thanks for the help to make this successful, and to the audience. So I want to just give some background. My name's Jim McCormick. I'm an emergency medicine physician by training and by board certification. I worked my way through that career arc and moved over to Concentra, where I covered all of the clinical operations for the West Coast for their OCMED and urgent care centers in Oregon, Nevada, California, Hawaii, et cetera. And so I have a good understanding about how OCMED interrelates to some of these issues. Further on in my career, I've been most recently the national director for auth management. So for people who are applying for healthcare benefits, I would be the person that looked at large patterns. So millions of patients looking for healthcare and what was driving the demand for different procedures or different treatments or different medications, and try to interpret what was driving those trends, and then create some ways for us to address that and try to settle that. Jeff and Jason asked me to take a look at the literature and say, what is the literature telling us about the effect of pest control and healthcare? And specifically, I was astonished. So if we look at Agent Orange as sort of the the canary in the coal mine. We built a fund for 180 million somewhat dollars as a settlement fund to cover the cost of care for veterans who came back from serving the country and were in it. They were sprayed as part of the combat scenario with herbicides. And so now that Agent Orange settlement funds covers things like bladder cancer, leukemias, multiple myeloma, non-Hodgkin lymphomas, prostate cancers, lung cancers, diabetes, hypertension, hypothyroidism, heart disease, Parkinson's disease, and others. And what that means is that these pesticides are potentially causing or are strongly associated with disease. I'm going to give you 3 examples for you to think about and how pesticides affect our collective health in the individual, the family, and the community. So autism is a disorder that challenges the way people perceive, receive, interpret, and process information and then express it. You can be incredibly gifted and brilliant, and there are certainly examples of that in the world, but I think the vast majority of people with autism have a lot more difficulty navigating the world. So Shelton et al. Created a gradient where people who were living near farms where pesticides were being applied at 3/4 of a mile, 1 mile, and just over a mile. So these people aren't dealing with the pesticides directly. They're downwind of the application. So a couple of stats to think about here. If you are a mother living within 0.9 miles, so about a mile from the application site, you had a 60% chance of an increased risk for autism spectrum disorder. This increases to 2 times, so doubling the risk if it's an exposure in the 3rd trimester at that distance. If you're in the 2nd trimester and it's chlorpyrifos, that increases the odds ratio to over 3, so 3 times more likely to have a child with autism if you're in that zone, in that community, and you're downwind of where those pesticides are being applied. So it's not cause and effect, it's a strong correlation, it's a strong association. And if I'm looking at a population of 10,000 people and I know that something's going to triple the risk, I know that in that population, there's going to be an increased rate of that disease or that illness, that condition. And that's why this work that Jeff and Jason are spearheading is really important. For Parkinson's disease, which that picture with the gentleman spraying without any protective gear at his age is just absolutely what we would expect to see with potential for Parkinson's disease. So if you ever used any household pesticide in this one particular study by Shilpa et al., it increased the risk of Parkinson's disease by 47%. So almost 50% increase in getting the disease if you were working with any pesticides. If you frequently used organothiophosphate, the risk doubles to almost 200%. So that's not saying that everyone will get it, but in a community of 10,000 people, if I have 100 people with Parkinson's disease, I know that a subset of those people are going to have double the risk for Parkinson's. Mm-hmm. And if they ever used a carbamate, it's up 455%. And so that type of risk just begs the question, can we do something differently or better? And then lastly, I just want to talk about 2 or 3 specific cancers. If you are exposed to certain pesticides, and I can take specifics offline and after the fact, I want you to think about blood cancers and lymph node cancers. So in the first year of treatment for a leukemia, a blood cancer, the treatment costs almost $300,000 in that year. In your last year of life, it's $635,000 for that treatment. For lymphoma, it's $150,000 in the first year, $275,000 in the last year of life. And so for me, the takeaway is, why would I want to immerse myself in these chemicals? Why would I want to spray them, inhale them, touch them, have them get onto my eyes and mucous membranes, and potentially, get one of these diseases? To me, it's just common sense. Let's reduce the pesticide exposure. Let's reduce our risk of disease. Let's make sure that our colleagues and our employees are safer by using these non-pesticide or non-toxic approaches. These are around our commercial facilities, on our government property. And Jason, 25 billion acres, that's astonishing. They surround our educational facilities. They're being applied in the parks and recreational areas where we and our kids enjoy, to go out and play at Frisbee or on the monkey bars. And so, Jeff, you came up with this concept of pesticide-free zones, and I'm going to hand it back to you. But I think that's a great concept that you're spearheading.
Well, and it's certainly something, as I mentioned earlier, I have 4 grandchildren, so I think of my grandchildren and the fact that they're going to public schools here in the Reno area. And I know that those public schools contract their pest management programs. And so that causes me some concerns on what's being applied in and around the schools. And one of our agendas is to create school districts, and there are, I believe, 21,000 school districts in the United States. Districts that can adopt a policy and a program that's truly a pesticide-free program.
And this goes to bases too, right? Like they were talking about. Somebody was talking about, hey, stop using this stuff on bases. You got kids on bases too.
Yep,
that's right. In military housing, absolutely.
Right. Yeah.
Great call, Dave. Thank you.
No doubt about it.
All right, Jason, Jeff, I think we go back to you now.
Now I was looking at this real quick. There's your impact from your Agent Orange use, so that's also in here for you. But you mentioned this glyphosate's been sprayed over 50 years, right, Jeff?
That's right.
Yeah, and at a 5 times rate as compared to Agent Orange.
That's incredible.
Yeah.
So some of the key takeaways.
It also begs the question of, once that becomes more known, and there are literally now hundreds of lawsuits against Monsanto and Roundup, and by extension Bayer, who owns the product now. It begs the question: who pays for that? The health care of those individuals that suffer from that down the road, because it's all not here right now, but it's a wave that's coming. Go ahead, Jim.
Yeah, Jeff, I should have brought that up. You're absolutely right. We are all the wallet that pays for this, whether it's Medicare, Medicaid, TRICARE, VA care, whether it's correctional institutions, commercial policies, or ACMED. That's all coming out of our taxes and our premiums. And so we're all chipping into this. So if we can do better, we probably should. There's a direct self-interest on our healthcare and our wallet.
Yeah. And I think you're seeing that in HHS with Secretary Kennedy.
Yes.
And he's doing a lot of movement that's happening. And you mentioned it before. This is in his sights. Dyes are in his sights. Good, better nutrition for us and everything that it touches. And we're talking about that as part of this too, with the farmers using these products. So some of the key takeaways for everybody: the IPM model. What does that stand for again, Jeff?
Integrated pest management.
To really look at it and start breaking that down, reducing your risk. You get health benefits from that. Regulatory compliance. You don't have to wait for regulatory compliance, but hey, start moving, doing what you can now to reduce some of that exposure, preventative versus reactive costs. Love that with some of the comments earlier. And protecting people, property, and asset protection. We'll even throw in pets, right?
Yep.
We'll even throw in pets to that.
And Dave, I'd add to that, on the risk management piece. I mean, the risk health is one thing, but in addition to that, the costs associated with litigation, on this, it's tremendous, and it's just going to continue to grow, particularly as we're seeing the example of the glyphosate and the Roundup cases. So it's incumbent on us to choose other products that are not going to put our people at risk and that are more beneficial. But again, we know we've got weeds, so we better come up with something.
And we got bugs, and we got rats.
That's exactly right. So
they're not going away, even as much as you do to do that. So one more thought for everybody with Doge. We're all dealing with this, right? In every way we can. How do you see this fitting into that? You want to take this one? Who wants to take this one?
Well, this is a pretty easy one for me because, you look at if you reduce the amount of pesticides, it automatically reduces to reductions in cost. And it also probably reduce the cost of labor that's associated with the application of it. You know, if you take that doctor's mentality that Jeff spoke to earlier, you know, it doesn't mean you have to go out there and apply stuff every month. You know, there's other ways to monitor things where you know there's activity before you actually put the labor cost toward it. Of course, I think lowered chronic illness is, I think, everybody's goal here, just reducing the overall pesticide footprint and the amount of pesticides that affect our entire world, actually.
And I just want to go back to a couple things for people addressing. I did this earlier. I want to pull it up. Just saying, hey, I think we did a pretty good job. There are alternatives. Each one of those can be, once you diagnose it, then you can make the recommendation, right, Jeff?
That's right. And there will be good recommendations that are sound recommendations that will still take care of the problem. You don't have to just rely on a harsh pesticide. Yeah,
I agree. And so doing this, adopting prevention, love that. We talked about being able to, there are things, what can they do right now? First of all, they can do a little review of what's happening on their base. They could take a look at the SDSs, right? That's another piece. But with that label thing that you mentioned?
Label SDS, yes.
Label SDS, they could do that. And then if you're talking about alternatives, we're actually going to pop this up for the next thing, which is, hey, if you want to continue the conversation with what we have for you guys, what would you like? We can schedule a site visit. You can actually request a survey of what you're doing for your pesticides. And if you'd like to discuss a pilot, you're working with different agencies to develop pilots for their non-toxic, right? That's the idea, is to continue this down the pipe, and one-on-one with folks with ecological engineers. If you have something else, love to know about that. If you have any last minute questions, we do want to get you guys out of here in just a minute. So we will come back to last minute questions in just a second. If you would like, as I mentioned earlier, you don't have to buy from any vendors here on GovBrief, but I will say this, you can if you want to, because Ecological Engineers is open for business, number one, right, Jeff?
That's right.
And number two, if your contracting folks need a path, a lot of folks in this industry that'll be able to help them, right? Right, guys?
That's right.
And you're working on your GSA contract, which is important because all procurement is now going to be going there. So real quick, by the end of today, early tomorrow, you'll get a recap email, which will have the presentation, the video link, as well as if you need CE cert requests, let me know. We'll make sure that we'll get that for you too. If you need a continuing education cert, what we do is we supply that to you. You just get approval from your supervisor. Everything's cool. And then you can also do one-on-one meetings with the folks that are here, and you'll funnel them in the right place, right, Jason?
Yep.
And if you have any last-minute questions, please raise your hand, pop it in the chat. If you have something you don't want everybody and their mother to see, send it to Jeff. That's Jeff's email, right? So you can get that. And I just want to say thank you very much, guys. I think it was great information. Jason, Jeff, Jim, the 3 J's, really good stuff. I learned a lot. Hopefully you guys did too. Anybody else got any last minute questions before we do this? Let me just check the Q&A, make sure that I got that. I don't have anything in the Q&A at the moment. We did have the questions about foam stream pricing versus glyphosate, which with Chip, same thing with rodenticide with Andrew. Keith is saying it's a great presentation. We appreciate that, Keith. We love the thumbs up. If they did a good job, let them know. Smiley faces, thumbs up, hearts. We love all those. And then Karen's asking, remember she asked a question about an eco-friendly product for termites. Any idea? You mentioned that too, right? You told her? Is that right, Jeff? What did you say?
There are some products out there. And one of the things that I think we unfortunately have a traditional approach to termites that you've got to just treat the whole house. For example, if you have subterranean termites, for example, that pest control guy is going to recommend treating the entire house. And same with drywood termites, which are the type of termites where they fumigate, put the tents on houses. But there's some interesting technology coming down the pike. One of them is a product called Termitrack, and it's actually a unit that detects motion inside of the wood itself.
Wow.
So rather than do this entire treatment of an entire home, you can literally locate where these termite infestations are at, and then locally treat them as opposed to whole house treatments. And there are baits, colony elimination systems that are out there, very, very low toxic, that are also worth exploring. But the main thing I would say is just, don't overreact and start feeling like, that you've got to start, dumping 100, 200 gallons of pesticide to control a subterranean termite problem on a property, because I think there are much more ecologically acceptable ways to do it than that.
Nice. Very nice. And if you have any last minute questions, we'll stick around as long as you want. Corbin, you're welcome. You're welcome, Corbin. We appreciate your time. Appreciate you guys joining us today. Great stuff. Jason, Dr. Jim, and Jeff. Awesome. Any last minute comments for everybody? I don't see anything else right now, but if you need anything from them, let them know, because they're there to help.
Thank you.
Thank you, everybody.
Hey, everyone.
We appreciate it. Thank you very much. Great stuff. See you guys in a few.